The journey to parenthood. It's a path embarked upon by millions, each couple carrying a unique blend of hopes and dreams for the family they long to create. But between the lines of this beautiful narrative lies another story, one that speaks to the often unspoken challenges that can arise when navigating the complex world of fertility. For many, the journey is paved with uncertainty, a roller coaster of hope and disappointment, as months or even years pass without the confirmation of a positive pregnancy test. By delving into the science of fertility, we can navigate the journey to parenthood with greater confidence and a renewed sense of hope. In an era defined by scientific breakthroughs, our understanding of human reproduction has reached unprecedented heights. This knowledge provides couples with an invaluable tool, the ability to make informed decisions on their journey to parenthood. Today, couples are empowered to take a proactive approach to their fertility, utilizing scientific insights to optimize their chances of conception. From the intricate interplay of hormones to the remarkable journey of sperm, knowledge paves the way for informed action. It's time to embrace the science of fertility, to replace uncertainty with knowledge, and to embark on this incredible journey with a renewed sense of hope and empowerment. The process of conception is a remarkable feat of biology, a carefully choreographed symphony of events that unfolds within the human body. At its core, fertility hinges on the successful collaboration of the male and female reproductive systems. Understanding this intricate dance is the first step towards demystifying the science of fertility. The successful union of sperm and egg marks the true miracle of conception. This newly formed zygote then embarks on a journey down the fallopian tube, eventually reaching the uterus, where it will ideally implant and begin the remarkable process of embryonic development. The intricate dance of hormones orchestrates the remarkable biological symphony of conception. Follicle-stimulating hormone, FSH, stimulates the growth and development of ovarian follicles. Luteinizing hormone, LH, acts as the final catalyst for ovulation, causing the follicle to rupture and release the mature egg. Estrogen and progesterone prepare the uterine lining for the potential arrival of a fertilized egg. If conception does not occur, levels of both estrogen and progesterone decline, triggering the shedding of the uterine lining and the onset of menstruation. The female reproductive system operates on a delicate cycle, a rhythmic ebb and flow of hormones and physiological changes that dictate a woman's fertility. The menstrual cycle can be broadly divided into two main phases, the follicular phase and the luteal phase, separated by ovulation. Ovulation typically occurs around day 14 of a 28-day cycle, but variations are common. The luteal phase is characterized by the formation of the corpus luteum and the production of progesterone. If implantation does not occur, the corpus luteum degenerates, hormone levels decline, and the uterine lining is shed during menstruation, marking the start of a new cycle. In the intricate dance of fertility, timing emerges as a paramount factor. The window of opportunity for fertilization each month is surprisingly narrow, highlighting the importance of understanding and tracking ovulation. This delicate balance of timing underscores the need for couples to engage in intercourse during the most fertile days of a woman's cycle. Factors such as stress, illness, medication, and even travel can influence the delicate hormonal balance that dictates ovulation. By embracing methods that provide personalized insights into a woman's unique cycle, couples can maximize their chances of conception. The human body provides subtle cues and signals that can guide couples on their journey to conception. Charting basal body temperature, BBT, is one of the simplest methods for tracking ovulation. Another valuable indicator of ovulation is cervical mucus, which changes in response to fluctuating hormone levels. In the days leading up to ovulation, cervical mucus typically becomes more abundant, clear, and slippery, resembling raw egg whites. By combining BBT charting and cervical mucus monitoring, couples can pinpoint their fertile window with greater accuracy. Understanding the fertile window is crucial for increasing the chances of conception. The fertile window encompasses the 6 days leading up to and including ovulation. Couples are encouraged to engage in intercourse every other day during this period. By embracing a combination of ovulation tracking methods, couples can gain a deeper understanding of their unique cycles. Knowledge is power, and by understanding the intricacies of ovulation and the fertile window, couples can approach the journey to parenthood with a renewed sense of hope and optimism. The age factor, a biological reality. The passage of time, while often celebrated for the wisdom and experience it brings, also ushers in a biological reality that can impact a woman's fertility, declining egg quantity and quality. This decline, a natural part of the aging process, begins gradually in a woman's late 20s and early 30s, becoming more pronounced after the age of 35. While conceiving naturally in one's late 30s and beyond is certainly possible, it's essential to approach family planning with a realistic understanding of the biological clock. A woman is born with a finite number of eggs, a precious reserve that steadily diminishes throughout her reproductive years. As she ages, not only does the quantity of eggs decline, but the quality of the remaining eggs also tends to decrease. This means that the eggs may be more likely to have chromosomal abnormalities, which can make fertilization less likely or increase the risk of miscarriage. While the age-related decline in fertility is a natural phenomenon, it's not a reason to despair. Knowledge is power, and understanding the impact of age allows women to make informed decisions about their reproductive timeline. For those considering delaying pregnancy, egg freezing offers a potential solution, preserving younger, healthier eggs for future use. It's important to remember that age is just one piece of the fertility puzzle. While it's a significant factor, it doesn't dictate the outcome. Many women conceive naturally and have healthy pregnancies well into their late 30s and beyond. By focusing on overall health and well-being, addressing any underlying medical conditions, and seeking guidance from a fertility specialist when needed, women can navigate the journey to parenthood with greater confidence, regardless of their age. The weight factor, striking a healthy balance. Maintaining a healthy weight is not just about fitting into a certain dress size, it's about nurturing your body's ability to function optimally, including its reproductive capacity. Both ends of the weight spectrum, being underweight and overweight, can disrupt the delicate hormonal balance that underpins fertility, highlighting the importance of striving for a healthy weight within a normal body mass index, or BMI range. For women who are underweight, defined as having a BMI below 18.5, the body may perceive a state of nutritional scarcity, leading to irregular ovulation or even the cessation of menstruation altogether. This is because a certain amount of body fat is essential for hormone production, and when body fat dips too low, hormone levels can become disrupted, impacting ovulation. On the other end of the spectrum, being overweight or obese, defined as having a BMI of 25 or higher, can also interfere with fertility. Excess body fat can lead to an overproduction of estrogen, disrupting the delicate hormonal balance required for regular ovulation. Additionally, insulin resistance, a condition often associated with obesity, can also negatively impact ovulation and egg quality. The good news is that weight, unlike age, is a modifiable factor. By adopting a balanced and nutritious diet, engaging in regular physical activity, and seeking support from healthcare professionals when needed, women can work towards achieving and maintaining a healthy weight, optimizing their chances of conception and supporting a healthy pregnancy. Remember, it's not about striving for perfection, but rather about making sustainable lifestyle changes that promote overall health and well-being. The journey to parenthood is often portrayed as a purely biological process, but the reality is that our lifestyle choices play a profound role in shaping our reproductive health. From the foods we consume to the habits we cultivate, our daily decisions can either support or hinder our fertility, highlighting the importance of making conscious choices that align with our reproductive goals. One of the most impactful lifestyle factors is smoking. The harmful chemicals in cigarettes not only damage the ovaries and eggs, accelerating the natural decline in egg quality, but they can also interfere with hormone production and increase the risk of miscarriage. Quitting smoking is one of the most significant gifts you can give your body, not just for your overall health, but also for your fertility. Excessive alcohol consumption is another lifestyle factor that can negatively impact fertility. Alcohol can disrupt hormone levels, interfere with ovulation, and increase the risk of miscarriage. While moderate alcohol consumption is unlikely to pose significant risks, it's generally recommended that couples trying to conceive abstain from alcohol altogether or limit their intake to a minimum. Stress, an inevitable part of modern life, can also wreak havoc on our hormonal balance, impacting fertility. Chronic stress can lead to elevated levels of cortisol, the stress hormone, which can interfere with ovulation and reduce the likelihood of conception. Incorporating stress reduction techniques such as yoga, meditation, or spending time in nature can help to mitigate the negative impacts of stress on fertility, promoting hormonal balance and overall well-being. While the journey to parenthood is often portrayed as a straightforward process, the reality is that underlying medical conditions can sometimes pose roadblocks, making conception more challenging. These conditions, some more common than others, can affect various aspects of the reproductive system, from hormone production to the health of the fallopian tubes. Polycystic ovary syndrome, also known as PCOS, a hormonal disorder that affects approximately 1 in 10 women of reproductive age, is a common culprit behind fertility challenges. PCOS is characterized by irregular periods, elevated levels of androgens, which are male hormones, and the presence of multiple small cysts on the ovaries. These hormonal imbalances can interfere with ovulation, making it difficult for women with PCOS to conceive naturally. Endometriosis, another condition that affects a significant number of women, occurs when tissue similar to the lining of the uterus grows outside the uterus, often on the ovaries, fallopian tubes, and other pelvic organs. This misplaced tissue can cause inflammation, pain, and scarring, potentially interfering with ovulation, fertilization, or the implantation of a fertilized egg. Thyroid disorders, which affect the production of thyroid hormones, can also impact fertility by disrupting the delicate hormonal balance required for ovulation and regular menstrual cycles. Both an overactive thyroid, known as hyperthyroidism, and an underactive thyroid, known as hypothyroidism, can interfere with conception, highlighting the importance of addressing any underlying thyroid imbalances. The good news is that with proper diagnosis and treatment, many women with these conditions can go on to conceive and have healthy pregnancies. If you suspect you may have any of these conditions, it's essential to consult with a healthcare professional for proper diagnosis and management. In the intricate tapestry of fertility, we often find ourselves focusing on the complexities of the female reproductive system, with its intricate cycles and delicate hormonal balances. While understanding female fertility is undoubtedly crucial, it's equally important to acknowledge the often overlooked half of the equation: male fertility. Conception, after all, is a shared responsibility, a delicate dance that requires the harmonious interplay of both partners' reproductive health. It's a common misconception that fertility challenges predominantly lie with the female partner. However, studies indicate that male factors contribute to infertility in approximately 40 to 50% of couples struggling to conceive. This highlights the crucial need to move beyond traditional gender roles and embrace a more inclusive understanding of fertility, recognizing that both partners play equally vital roles in the journey to parenthood. Male fertility hinges on the production of healthy sperm in sufficient quantities, capable of navigating the female reproductive tract and successfully fertilizing an egg. This intricate process is influenced by a multitude of factors, ranging from genetics and overall health to lifestyle choices and environmental exposures. By understanding these factors, men can take proactive steps to optimize their reproductive health, increasing the likelihood of conception and supporting their partners on the journey to parenthood. This section delves into the often overlooked realm of male fertility, exploring the key factors that influence sperm health, common causes of male infertility, and evidence-based strategies for improving sperm quality and optimizing chances of conception. It's a call to action for men to become active participants in their reproductive health, embracing knowledge and empowering themselves to make informed choices that support their fertility journey. Nurturing male fertility factors and solutions. Just as female fertility is influenced by a complex interplay of factors, male fertility is equally multifaceted, shaped by a combination of genetics, overall health, lifestyle choices, and environmental exposures. By understanding these factors and their potential impact on sperm health, men can take proactive steps to optimize their fertility and increase the likelihood of conception. One of the primary determinants of male fertility is semen health, which encompasses several key parameters, including sperm count, motility, morphology, and DNA integrity. Sperm count refers to the concentration of sperm in a man's ejaculate, with a normal range considered to be 15 million sperm per milliliter or higher. Motility, on the other hand, reflects the percentage of sperm that are actively moving, essential for navigating the female reproductive tract and reaching the egg. Sperm morphology assesses the size and shape of sperm, as abnormalities in these parameters can hinder their ability to fertilize an egg. Finally, sperm DNA integrity plays a crucial role in successful fertilization and healthy embryonic development, as damaged DNA can increase the risk of miscarriage or birth defects. Fortunately, many lifestyle factors can positively influence sperm health, empowering men to take control of their fertility. Adopting a healthy diet rich in fruits, vegetables, whole grains, and lean protein provides essential nutrients that support sperm production and function. Regular exercise, particularly moderate-intensity activities, has been linked to improved sperm quality, while smoking, excessive alcohol consumption, and recreational drug use can have detrimental effects on sperm health and should be avoided. Nourishing your body, the fertility diet. The age-old adage, "you are what you eat," rings especially true when it comes to fertility. The food we consume provides the building blocks for our cells, fuels our hormonal systems, and directly impacts the health of our reproductive organs. Embracing a fertility-boosting diet isn't about deprivation or strict rules. It's about making conscious choices that nourish your body and create an optimal environment for conception. Think of it as providing your body with the finest ingredients to create the miracle of life. One dietary pattern that consistently garners praise for its fertility-enhancing properties is the Mediterranean diet. Rich in fruits, vegetables, whole grains, legumes, and healthy fats, this way of eating provides a powerhouse of antioxidants, vitamins, minerals, and fiber, all essential for hormonal balance, egg quality, and sperm health. Imagine vibrant plates piled high with colorful vegetables, drizzled with olive oil, and seasoned with aromatic herbs, a feast for both the senses and your fertility. Incorporating specific fertility-boosting foods into your diet can provide a targeted approach to enhancing your chances of conception. Leafy greens, such as spinach and kale, are packed with folate, a B vitamin crucial for healthy cell division and fetal development. Fatty fish like salmon and mackerel are excellent sources of omega-3 fatty acids, which support hormone production and regulate ovulation. Don't forget the importance of zinc and vitamin E for male fertility. Sunflower seeds, pumpkin seeds, and walnuts are all excellent sources of these nutrients, which play vital roles in sperm production and motility. By making these dietary tweaks, you're not just nourishing your body, you're investing in your fertility journey, one delicious bite at a time. Supplementing wisely key nutrients for conception. While a balanced and nutritious diet should always form the foundation of your fertility journey, incorporating key supplements can provide an added layer of support, ensuring your body has an abundance of the nutrients it needs to thrive during conception and early pregnancy. Think of supplements as strategic allies, filling in any nutritional gaps and providing an extra boost to your reproductive system. One of the most crucial nutrients for preconception health is folic acid, a B vitamin that plays a vital role in cell division and DNA synthesis. Adequate folic acid intake is particularly important in the weeks leading up to conception and during early pregnancy, as it helps prevent neural tube defects, serious birth defects of the brain and spine. It's generally recommended that women trying to conceive take a prenatal vitamin containing 400 to 800 micrograms of folic acid daily, starting at least 3 months before attempting conception. This ensures that your body has ample stores of this essential nutrient to support the rapid cell division and growth that occur during early pregnancy. Beyond folic acid, Other supplements may be beneficial for both men and women on their fertility journey. Omega-3 fatty acids, found in supplements like fish oil or algal oil, have been linked to improved egg quality, hormone regulation, and sperm health. Vitamin D, often deficient in individuals living in colder climates, plays a role in hormone production and immune function. Coenzyme Q10, an antioxidant involved in cellular energy production, may improve egg quality in older women and support sperm motility. It's essential to consult with your healthcare provider before starting any new supplements, as they can assess your individual needs and recommend appropriate dosages. The journey to parenthood, while filled with hope and anticipation, can also be a time of heightened stress and anxiety. The pressure to conceive, coupled with the uncertainties of the process, can take a toll on both partners' emotional and physical well-being, potentially impacting fertility. Recognizing the interconnectedness of our minds and bodies is crucial, as chronic stress can disrupt the delicate hormonal balance essential for conception. When we experience stress, our bodies release cortisol, the stress hormone, which in short bursts helps us cope with challenges. However, chronically elevated cortisol levels can interfere with ovulation, decrease sperm quality, and even suppress the immune system. Imagine your body in a constant state of fight or flight, prioritizing survival over the intricate processes of reproduction. Incorporating stress management techniques into your daily routine is essential for creating a more conducive environment for conception. Mind-body practices such as yoga, meditation, and deep breathing exercises have been shown to reduce cortisol levels, promote relaxation, and improve sleep quality. Engaging in activities that bring you joy, whether it's reading, listening to music, or spending time in nature, can also help to alleviate stress and restore a sense of balance. Remember, the goal isn't to eliminate stress entirely, as that's an unrealistic expectation in today's fast-paced world. Instead, it's about equipping yourself with the tools and techniques to manage stress effectively, creating pockets of calm amidst the journey, and fostering a more harmonious environment for conception. The power of sleep restoring hormonal harmony. In our fast-paced, always-on society, sleep often takes a back seat to work deadlines, social engagements, and endless to-do lists. However, we underestimate the profound impact sleep has on our overall health and well-being, particularly when it comes to fertility. Sleep is not merely a time for our bodies to rest. It's a period of essential rejuvenation and repair, during which hormones are regulated, cells are regenerated, and energy levels are restored. When we consistently shortchange ourselves on sleep, our bodies produce less melatonin, a hormone that not only regulates our sleep-wake cycle, but also plays a role in protecting eggs from oxidative stress. Additionally, sleep deprivation can disrupt the production of other crucial hormones, such as follicle-stimulating hormone, FSH, and luteinizing hormone, LH, both essential for ovulation. Prioritizing sleep is not a luxury, it's a non-negotiable investment in your fertility journey. Aim for 7 to 9 hours of quality sleep each night, creating a relaxing bedtime routine that signals to your body it's time to wind down. This could include taking a warm bath, reading a book, or listening to calming music. Make sure your bedroom is dark, quiet, and cool, as these factors can all contribute to more restful sleep. By making sleep a priority, you're not just catching up on rest, you're restoring hormonal harmony, supporting healthy egg and sperm production, and creating a more fertile environment within your body. Remember, the journey to parenthood is a marathon, not a sprint, and adequate sleep is essential fuel for the journey ahead. Exploring assisted reproductive technologies, ART. For many couples, the journey to parenthood unfolds naturally, a testament to the remarkable efficiency of the human reproductive system. However, for those facing challenges conceiving naturally, advancements in medical science offer a beacon of hope. Assisted reproductive technologies, or ART. ART encompasses a range of procedures designed to assist couples in overcoming infertility and achieving their dream of having a child. One of the most commonly known ART procedures is in vitro fertilization, or IVF. IVF involves retrieving mature eggs from the woman's ovaries and fertilizing them with sperm in a laboratory setting. The fertilized eggs, now embryos, are then cultured in a controlled environment for several days, before being transferred back into the woman's uterus, with the hope of implantation and a successful pregnancy. Intrauterine insemination, or IUI, another commonly used ART procedure, is a less invasive option that involves placing a concentrated sample of washed sperm directly into the woman's uterus during ovulation. IUI bypasses the cervix and places the sperm closer to the egg, increasing the chances of fertilization. For couples facing male infertility, intracytoplasmic sperm injection, or ICSI, offers a solution. This sophisticated procedure involves injecting a single healthy sperm directly into a mature egg, bypassing the need for the sperm to penetrate the egg's outer layer. This technique is particularly helpful in cases of low sperm count, poor sperm motility, or abnormal sperm morphology. Navigating the ART journey. Considerations and hope. Embarking on the ART journey can be both emotionally and financially demanding, requiring careful consideration, thorough research, and open communication between partners. It's essential to approach this path with a realistic understanding of the procedures involved, the potential risks and benefits, and the emotional toll it can take. Success rates for ART procedures vary depending on several factors, including the age of the woman, the underlying cause of infertility, the clinic's experience, and the couple's overall health. It's crucial to have honest conversations with your fertility specialist, asking questions about success rates, potential complications, and alternative treatment options. Beyond the medical aspects, the RT journey can also evoke a roller coaster of emotions: hope, excitement, anxiety, disappointment, and everything in between. It's essential to acknowledge these emotions, seek support from loved ones, and consider joining support groups or seeking professional counseling to navigate this challenging time. While the ART journey can be demanding, it's important to remember that advancements in medical science have helped countless couples overcome infertility and experience the joy of parenthood. With the right information, a supportive medical team, and a resilient spirit, hope continues to blossom for those seeking to build their families through ART. A journey of hope and empowerment. The journey to parenthood, as we've explored throughout this comprehensive guide, is a testament to the intricacies of the human body, the power of scientific understanding, and the resilience of the human spirit. While the path to conception may not always be straightforward, knowledge is power, and by understanding the science of fertility, couples can navigate this journey with greater confidence and a renewed sense of hope. From the delicate dance of hormones that orchestrate ovulation, to the remarkable journey of sperm as it navigates the female reproductive tract, fertility is a symphony of biological processes, each playing a crucial role in the creation of new life. By embracing a holistic approach to fertility, acknowledging the interplay of age, weight, lifestyle choices, and underlying medical conditions, couples can create an optimal environment for conception, supporting their body's natural ability to conceive. Remember, the journey to parenthood is unique for every couple, and there's no one-size-fits-all approach. Whether you're just beginning to explore the possibility of conception or have been navigating fertility challenges for some time, it's essential to seek guidance from healthcare professionals, ask questions, and become active participants in your reproductive health. As you embark on this extraordinary journey, may this guide serve as a source of knowledge, empowerment, and hope. May you approach each step with informed decision-making, unwavering support for one another, and the unwavering belief that the dream of parenthood is within reach. This wraps up our deep dive into the science of fertility. If you found this video helpful, please hit the like button and also share it, as this will help this content reach a wider audience. Make sure to subscribe and turn on your notifications. Thanks for watching.